Thank you all for being here and also present on online with the computer. So I'm going to try to tell you a little bit about NextKidney and some other European news. Now, the very first time that ideas was given, this was more or less my opening slide also. In 1962, they had this World Fair here from an out of this world. Well, I know Seattle is still out of this world. It's amazing. And they still have the tram and the Space Needle, but now they also have ideas, which draws even more tourists in. So it's now 2022. I'm also talking a little bit on behalf of the Dutch Kidney Foundation here, who I'm consulting, and the European Kidney Health Alliance, but you will hear more of that from Raven Holder, who will speak on behalf of ECHA after me. So what is NextKidney and what is this news from Europe? Well, first of all, we have to be careful and have the statements of conflicts of interest. My interest in the conflict in Ukraine is reflected by the colors, and my conflict of interest is that I work 100% for IMEC, a not-for-profit research and development hub in nanotechnology and chip technology. I'm hired for 5% by the Dutch Kidney Foundation of my time for consultancy to them in innovation. And another 5% I'm hired by the Neo Kidney Initiative. That is really trying to make something as a product work. Then I am also mandated as an associate professor part-time at the University of Utrecht, and I have the pleasure to work with Jeroen there, and of course Karin Gerritsen and Roos Maasreeuw and many other great people. Then they made me the voluntary chair of ECHA work group Breakthrough Innovation, which Raven Holder will tell more about. And I also work on standards. So I help to write the international standards of dialysis technology. And I can tell you, can give you the tip, if you really have a breakthrough innovation and you want to get it to the market, then be quick to jump into the standardization committees, because there are the door that every firm has to go through to the market. So if it's not in the standard and it's in your device, then you have a problem. If you get it into the standard, you have a better chance of getting to the market quicker. Good. Now, this morning we had a very touching movie, which I liked very much, because my friend Nancy Spaeth was in there. She was a remarkable patient, a truly remarkable personality, very warm. And I met her, I think she was the first American kidney patient that I really learned to know, and also a very remarkable person. And that was in 2015. At the Patient Preferences Workshop organized by FDA and KHI, which I think was a historical thing because they put the patient central, and that was great. And they kept doing that, which is also great and also done here in Seattle in Ideas. Now, this is Nancy when she was much younger and when she was on dialysis. And you notice the keel dialyzer, so that's the dialyzer, the big flat thing, that's the filter. And she did that at home. In fact, in 1972, when this picture was made, 90% of Scribner's 130 patients, they did their dialysis at home. And that was, so home dialysis was the normal thing to do, and in the center was the weird thing to do. We have to look upon that. But okay, since then, the machines have become smaller, and nowadays we are seeing new machines coming up specifically made for home dialysis, which is a good thing, because until very recently we had very big machines devised for in-center being used at the home. And now we see dedicated home machines like the NX stage, the Quanta with the funny flap opening, I like that. The Visidia as well, and the Tableau. And there's even more, we saw a few more. So these are, of course, nice machines, but they are all single-pass machines. And what does single-pass mean? Well, you have a huge amount of dialysate fluid, and we heard earlier today also that dialysis fluid is a limiting factor for portability. You use it once, pass it through the filter, and then you discard it in the dump. You dump it in the drain. So you're stuck to the wall. because that is not doable underway. Whereas if you would reuse that and clean it up again and make it a closed circuit, that already would help you a little bit on portability. I always compare this with a car. You have a car, you have an engine. If it's a petrol engine, it has to be cooled by water. So it would be a stupid car if it would be cooled by a big hose and your motor would run too warm if the hose was too short. That would be a stupid car. That's why you have a closed circuit, so that you don't have to have a hose behind you of several kilometers. So as a patient, you'd also like to have a closed circuit for your dialysate. But that's just the beginning. What Bill just told, that is the real future. And what this morning we saw with the xenotransplants, that is also the real future. But in between, we have to make do with incremental improvements. And I want to highlight, and it's a pleasure to also have Steve Ash here in the public. So, you have the expert here. Talk to him. That's a great opportunity. Who is a guy that is working a long time on sorbent technology and call this nicely, that's why I copied the slide, the sine qua non of portable kidneys, at least portable dialysis. Now, interestingly enough, on the same European Society for Artificial Organs Day, also the inside-out membranes were highlighted. So nothing happens by chance, as I always say. Anyhow, profit from the fact that people are there in the conference. This is then the NextKidney. It is a machine which is being made with a lot of investment from the Dutch Kidney Foundation in the New Kidney Initiative. There's a partner firm in Switzerland which now runs NextKidney, and also technology from Singapore is in there. It is in principle suited for all kinds of regimes, but you have to weigh in the size of your sorbent cartridge. It uses 6 liters of dialysate, and it is double isolated, which means it does not need grounding to rely on safety. It can be safe, perfectly safe, full cardiac floating without needing any grounded outlet. So that means you don't have, with the volume, no plumber needed, and with the electricity, no electrician needed. You don't have to remodel your home. You can do it in a mobile home, you can do it at the camping. As long as you have power and you bring your disposables, you can dialysate. Of course, there's a wireless connection, wireless connectivity and telemonitoring inside, but many of the machines nowadays have that, so that's normal. The efficiency is comparable with existing hemodialysis machines, but it's much more portable. It's in fact so portable that it would fit in a carry-on trolley for on the airplane. Because one of the patient-centered things that we learned was that patients are extremely afraid if they check in separately their machine, and that they will arrive in Tokyo, and that their machine will arrive in Toronto. And T&O, sounds very funny, yeah. But that is the nightmare that you have. And if you can take it as hand luggage, you put it in the overhead bin and you know it's there. And that is a very comforting feeling, as they assured me. Now, the sorbent is the secret, and that was developed by, I cannot help to highlight 2 people that are extremely important for that sorbent. Marty Roberts, who started working on the Ready machine a long time ago. He got 102 years old. He died this year, but he died after he witnessed that at the German conference, he had a huge standing ovation for his work on sorbents. So he knew that before he went. And a younger guy, Christian Bruckel, who lives in Singapore but comes from Germany, also has done a lot of work on this sorbent technology, and he has done the work on the hemodialysis variant. So what you see to the left is the wearable PD system with a regenerative sorbent, and to the right you see the cartridge for the hemodialysis system. So how does it work? Well, there's a nice animation here. What we see is that we have the spent dialysate, which is going out of the filter, of course. It goes into the sorbent cartridge. Out of that comes a purified dialysate, but it misses 2 electrolytes. So those have to be replenished And then we have as good as new fresh dialysate. The pH is stabilized by the system, and so you have a closed loop. Of course, the cartridge will deplete during the function. On the blood side, there's no difference. The machine has no different specifications on the blood side as normal machines. Just the dialysate side is reusing cleverly the volume. And the sorbent has quite a bit of similarities with the old ready sorbent, but it has been improved. So first of all, the sodium behavior that was seen in the ready is not here so much there. It's much improved. The red line that you see is much more horizontal, and that is the new type of sorbent, whereas the old, we always saw an increase of the sodium. So you had to start very low with the sodium and then you ended high, and here we are staying much more stable. It is also, I'm not having that in the text, but it's also the first machine that is now having the sorbent not in layers. So the old ready had layers of sorbent. If you had cracks in there, you could have a breakthrough. But each grain of this sorbent system contains the whole chemical system. So if there's a crack, it doesn't matter, because the grains all have the complete chemistry in them. It's the first regenerative machine that'll fit to the IEC 6601-2-16 standard, which I think is quite remarkable. Now, the sorbent has already been tested, and we are waiting for the reports to be published, but all went well as far as I heard. This has just been done in Singapore, in the National University Hospital there. So what they did, they used the sorbent to regenerate dialysate. That regenerated dialysate was going to a normal dialysis machine. The dialysis machine did not know it was getting regenerated dialysate. For the machine, it just was dialysate. It couldn't see the difference because there was no difference. And so the hemodialysis treatment was done with first a normal machine just to check first the sorbent. And the next step will be clinical trials in France, in Caen, with Professor Pieter, and of course, Professor Karin Gerritsen in Utrecht, where I proudly come from as well and work with. Two amazing people that are going to test this machine complete now with the whole system in the patients, and that is soon coming up. We expect to be CE marked by 2024, early, and then hopefully be able to go to the market. As many people here already pointed out, it takes a long breath to bring a product to market, and as Bill also said, it costs a lot of money to do all the testing and do all the paperwork and so on. And I know this is, of course, a relatively small step forward compared to the visions we have seen earlier today. But the good thing is it might be a bit faster at the moment. But I'm also very excited about the longer term and the future in which we will be having much better things. Having said this, the one thing that is also nice is it has a two-prong plug. So it's not depending on ground, it's completely safe without grounded outlets, no electrician needed, so it'll work in any place you'll stick it in, you just need the adapter. And then now for something completely different, I promised somebody a Monty Python slide today. In Europe, we are also seeing the great stuff that is being done in America. We've seen all this great efforts with KidneyX, the Kidney Health Initiative. The ASN is doing wonderful work here in Seattle, the Center for Dialysis Innovation, and we love it. And we also talked to the European Parliament and said, you know, we have to also organize ourselves like the Americans do and get things going, and maybe we should even, hopefully, work together transatlantically. And together with the American Association of Kidney Patients and the European Kidney Health Alliance and European Kidney Patient Federation, we made an infographic that was distributed in the European Parliament meeting. And this infographic, I hopefully, look at Cassandra, that it will be downloadable on the website of IDEAS as soon as the website is updated. so that you can have it for free and can just help us to spread the word that it is urgently needed, that we are needing, really the world urgently needs better kidney replacement therapies. And with that, I think I said enough for this lecture. If you want to reach me, feel free to reach out. I'm always happy to discuss. And I'm very, very excited being here in Seattle again. I never missed one. Well, physically I wasn't at all, but I always was either physically here or remote, and I hope to keep on doing so because I love what they're doing here. Thank you very much.